I'm Hermela Argawi from the CBS NLA newsroom. I want to bring in Dr. Kirsten Mewaldt, medical director of the emergency department at Dignity Health Northridge Hospital. Dr. Mewaldt, there are so many health implications when you're talking about a fire this size. What is it that you all see coming into the department?
We are definitely seeing a lot of individuals whose asthma is flaring up with the heavy smoke conditions right now. The air quality also impacts individuals who have problems such as heart disease, individuals, like I said, asthma or COPD. Certain populations are more at risk than others. For instance, children, the elderly, pregnant women. So all of these groups of people should definitely pay close attention to how they're feeling today. And if they're feeling that, they're not breathing well, and or definitely if they're having chest pain, call their doctor or think about seeking medical attention.
And so what are some of the things they can do to protect themselves? And could you elaborate on what they should be concerned about when they feel it? Because sometimes we all get a little bit irritated in our eyes, or we might feel something else that we just assume is normal. What is not normal, or what is worth being concerned about?
I think the best thing you can do is stay inside with your windows closed. The air quality is very unhealthy right now. If you have young children, keep them indoors as well. Don't let them go out to, the playground today. If you are starting to feel symptoms and feel, shortness of breath or chest pain, I think everyone is probably feeling a little off today. I know my lungs feel tight just breathing in the air that we have around us today. But for someone who has a history of asthma, COPD, heart disease, they should just be pay very close attention to their symptoms. And if you are someone with risk factors for heart disease and you feel chest pain, definitely that would be something to go to the emergency department for. Or if you're an asthmatic, and all asthmatics, they know their body, they know their lungs, and they know when they're starting to feel an asthma exacerbation going on. And if those home medications, inhalers, etc., aren't working, it's time to seek additional medical attention.
So there's also a huge emotional toll when we're talking about a fire this size, right? And part of that is people do feel the smoke, they feel maybe they're not breathing well, and they're worried about long-term effects. What would you say to people that are concerned about that?
I think, as I said earlier, stay indoors, or if you are lucky enough to have family members that live outside of this immediate area where the smoke is so heavy, maybe go there. Just avoiding exposure is the best thing you can do right now. A brief exposure is not something that should cause long-term effects. It's just doing your best to keep your way out of these situations where you are going to have heavy exposure.
Well, Dr. Mewaldt, we certainly appreciate your insight. Thank you so much for your work.